these genetics from our parents, which is why people think it must be genetic. But what else do we inherit from our families?
Eating habits.
Our eating habits, right? If you grow up eating a lot of fast food, you're going to eat fast food as an adult. And exercise habits as well. If our family is very active when we're young, we're probably going to be more active when we're older as well. Now, there's been some research where they took tens of thousands of people and they looked at their diets. And they wanted to see what diet has the lowest risk of type 2 diabetes. Okay, so over here, I want to make sure they can see me. All right, so this group over here is people who eat meat regularly. This group is people who eat meat once a week. This group is people who eat fish, eggs, and dairy, but no red meat, no chicken. These are the vegetarians, so no meat, no fish, only eggs and dairy, and all the other foods, of course. And then the vegan group, who doesn't eat any animal products. And the people who follow the vegan diet have the lowest risk of developing type 2 diabetes over their lives. I'm going to try not to fall here. Is there an emergency room if I do fall? Okay, there is. Okay, good. Got to try not to trip. All right, so when we're talking about plant-based diets, beans, grains, fruits, vegetables, nuts, seeds, tofu. Has anyone had tofu before?
I've tasted
I
it.
don't like
You don't like it? A little bit bland? Not much flavor? Yeah, you gotta add spices and sauces to make it taste good. All right, we don't encourage meat, fish, eggs, or dairy, so leave those off the plate. And for type 2 diabetes, we recommend keeping it low fat. So not cooking with oils. You can fry in some veggie broth or some water, steam the vegetables, boil vegetables, and then also nuts, seeds, and avo, all these high-fat foods. We recommend keeping them low. So you can still eat some of them, but keep it low. Okay, yes?
Wait a minute, I see, so on the left side, it says thumbs up
Yeah.
for seeds, but then on the right side,
Yeah.
thumbs down, and then it has, oh, you just have to limit the seeds.
Limit these,
Limit,
yes.
okay.
So you can still eat the seeds and the nuts and avocados and olives, but we're saying limit them,
Limit it.
okay? So instead of having a whole avocado for lunch, limit it. Instead of having a bag of nuts and you eat the whole thing, have just a small little handful.
Okay.
Yeah.
When you, for the vegan diet, I'm seeing soy, and I was told that soy was not good for like African Americans, and do you have any input on that?
There is, I hear, and I'm glad you asked that question because I know there is a lot that soy has, can have an inflammatory, increased inflammation. And then I read somewhere else it had something to do with balancing your omega-3 and 6.
And I also heard too that a lot of women with an African American community with breast cancer, that they contributed that to a high dosage of soy.
Yeah.
So I wanted to know, did you have any research
Yeah.
for that? Because I have a daughter in California who does the vegan thing, and she told me to stay away from the soy.
Yeah.
And so she does a lot of the oat milk or the almond milk and no soy. And
Yeah.
even with the So Delicious yogurt, you have that, a lot of it is soy, but then you have another one that's not soy. So I just wanted,
Yeah.
if you can espouse on that.
That's a great question.
Okay.
A lot of the concerns about soy come from because they have these things called estrogens, phytoestrogens. So it's a plant form of estrogen. Okay, so we have estrogen in our body. Plants also have a form of estrogen. They're very different. Okay, they're not exactly the same. Their structure is different, and they have different effects on our body. So whereas human estrogen can lead to breast cancer, causes breast tumors to grow, it stimulates them to grow. Estrogen that comes from plants like soy actually has the opposite effect. So we've seen that women who eat the most soy have the lowest risk of breast cancer. And even in women who have breast cancer, when they eat more soy, their risk of getting it again after they've gone into remission is also lower. So it actually has the opposite effect. So soy is actually very beneficial and protective. All right, very common misconception, and a lot of people are very scared of soy because of that, but actually the opposite is true.
So you were saying that, what's the two different types of soy?
The different types of estrogens.
Oh, the estrogen.
The estrogen is different, yeah. Yeah.
So soy has that.
Soy,
So it has an estrogen.
but it's not the same as the human
Right,
estrogen in
right.
our body.
Okay, and then, this young lady back here, what's your name?
Vanessa.
Vanessa. She said something about omega-3, so if that was a concern with the soy, then we probably need to do a little research on the omega.
Omega-3s, not very high in soy or any other beans. Omega-3s, if you're talking about plant-based foods, come mainly from your nuts and your seeds.
Okay, so what was your?
It's, there's omega-3s and omega-6s.
Yeah.
And I'm hoping you can articulate this better than I can. And I think it more has to do with soy oil, which you, in the horse world, it's, people always squawk about
Yeah.
products that are made with soy in it for horses because of the inflammation. I use a product that has soy, but apparently it's supposed to be balanced
Thank you.
in a way with the omega-3s and, with the omegas, you want more omega-3 than omega-6?
Yeah, yeah, you do. But just did a very long podcast episode all about seed oils. We spoke about soybean oil, so Hillary can send that to everyone if they want more
Oh, that
information
would be
about
good.
that.
Yeah.
Yeah, it was a really fun one.
Yes,
Thank
she
you.
has a podcast
All right.
on seed oils. So if you want me to send it to
Yeah.
you, let me have your email address and I'll send it to you. It's very educational,
Okay.
very educational.
Thanks.
Seeds,
It's the more
yeah.
information you get,
What
the
kind of
more
seeds?
confused you
Yeah.
get.
Oh,
in the
any
beginning.
seeds.
You know
Sesame,
what I mean?
sunflower.
That's what I feel quite often, cause it's a lot.
Yeah.
And everybody, one person, they used to say that if you,
Yeah.
that children of
You'll find it on the
vegetarian
bookmarks
diet,
as
this
well.
was 20 years ago, that young boys would develop breast tissue if they ate too much tofu. And that was proven to be wrong.
Yeah, it was.
Yeah, but it was a big,
Yeah.
big thing 20 years ago.
Yeah. Yeah.
Yeah.
All right.
Sorry.
So what we recommend focusing on is the power plate. So every time you do breakfast, lunch, or supper, try and have something from each of these groups. So some kind of fruit, some kind of grains like brown rice, some kind of legume, so beans, okay, lentils, and some kind of vegetable. Okay, so this is setting up your power plate at each meal. And I'm going to show you some research that shows that this is really effective. Okay, so do carbohydrates cause diabetes? What do we think?
No.
No?
Yeah, it could be, yeah, it's a possibility.
Possibility?
Uh-huh.
You have good carbohydrates and bad carbohydrates.
Okay, okay, yeah.
All carbohydrates are bad.
All right, so let me show you this quick little video.
Okay.
So this is what normally happens in your body. So you eat something with carbohydrates like potatoes, brown rice, fruit, vegetables, goes into your intestine and it gets broken down into these smaller sugars. And we absorb those sugars into our bloodstream, okay? And that's good, we need sugar for energy, okay? So what happens is,
Too much.
so you'll see here, this is one of your cells, this is a muscle cell, okay? These are all little sugars that are trying to get into the cell so it can be used as energy, okay? And normally we have insulin, which is a hormone, and it comes and it unlocks the cell so that the sugar can get into the cell, okay? We don't want too much sugar in the blood, we want to get it into our muscles so that we can use it for energy, okay? But when we eat foods like this,
Yummy.
Look at you, I know some of you love these foods don't love you back, I can promise you. All right, lots of fatty foods, okay? What happens? All this fat starts to get stored in your muscle cells and cells where it shouldn't be.
Needs spread by white potato.
White potatoes are
Yeah.
fine. It's when you deep fry them in lots of oil and you turn them into French fries, that's not so good. But a normal potato is okay.
Potato, not that sweet potato.
Sweet potato,
They good.
beautiful, beautiful.
Mm-hmm.
Yes. All right. So the problem here is when you have all of this fat sitting in your cells, it kind of acts like chewing gum in a lock, right? If you imagine we're trying to unlock the cells so that all the sugar can get into the cells. When you have all this fat here, it's like chewing gum and you can't unlock the cells. So what happens? The sugar can't get in, it stays in our blood, and our blood sugar levels go high.
Oh, wow.
Okay. So the problem is not carbohydrates. The problem is that our body can't handle carbohydrates when we eat too many of these fatty foods, okay? But the good news, all right, everyone looks a little depressed now. The good news is that we can reverse this, okay? So it's not there forever. So this is a study that we did at the Physicians Committee, the company I'm from. We took around 250 people and we split them into two groups. So plant-based, not plant-based, plant-based, not plant-based, okay? They ate foods like this: pasta, bean burritos, sweet potatoes. The other group made no changes. They just kept eating what they were eating. And we used a very fancy machine to look inside their cells. And this graph over here is the amount of fat sitting inside the cells, okay? The people who made no changes, the fat increased, okay? The people who ate the plant-based diet, the fat in their cells decreased, okay? And this is great. Did it help their blood sugar levels? Yeah.
Yes.
Their blood sugar levels improved at the same time. Okay, so I think we've kind of answered this question already. Should people with type 2 diabetes eat carbohydrates?
Yes.
Yes,
Yeah,
Uh-huh.
yeah, okay, good. So this is another study we did. And we split people into two groups again. Half of them ate the plant-based diet, lots of carbohydrates, but coming from the right kind of food, right? Not cookies and pastries and donuts. Beans and potatoes and, right, not sweets and Twizzlers and all those things, okay? The good carbohydrates. And half of them followed the diet that was recommended by the American Diabetes Association. And they said, just limit your calories. Eat the same foods, just make it smaller, okay? By about Friday, everyone was ready to eat their couch because they were so hungry, but they carried on. And the first line, the red line, these are the people that limited the amount of food. They lost a bit of weight and their A1C was reduced. Do you know what A1C is?
Yeah.
Yeah.
So it measures your blood sugar control over 3 months. So it gives you a longer picture than just a finger prick glucose, okay? So they improved, they lost some weight, and then they didn't do so well over the second half of the study. The people who ate the plant-based diet, their A1C started at about 8, okay, really high. And by the end of the study, it came down to 6.8, okay? And they were eating more carbohydrates than ever before.
I'm sorry, what's the normal range for your A1C?
Yeah, so you want it to be below 6 point,
What?
excuse me, 6.5.
Thank you. That's interesting because when you go to the doctor, some of them was going to tell you you're pre-diabetic if you fat, if you
5.7
5.9 and
to 6.
6.0, and they'll say, oh, you need to be on metformin or something
Yeah.
like
Right.
that. But if you are aware of your body and if you do some research and you can say, let's try diet and exercise and come back in 3 months and see what
Yeah.
my A1C is.
Yeah.
So you
So-
can't always, because it's a doctor, I'm sorry doctor, you can't always say, oh yes, I'll take this medicine. No, I can't.
That's exactly what we're trying to say. We're trying to
Yes,
say
I
here
see.
that diet and lifestyle is even more important,
Yes,
okay?
yes.
Medicine is completely necessary for many people. I'm not saying don't take your medication. Don't leave this talk and now go throw your metformin away.
But
But,
you and if your A1C is 5.9 or you diabetic,
Yeah.
and it's different natural things like your vegan. That,
Mhm.
and then you got
Exercise.
things like
Yeah.
berberine and things like that. So I
Yeah.
just say people be educated.
yeah, exactly. So normal's below 5.7. 5.7 to 6.5 is pre-diabetes, and then above 6.5 is diabetes. So we want
Dr.
to.
Everett said 6.5. I mean, most physicians will say, oh, you have diabetes at 6.5. 6.0, a lot of them will say you're diabetic. They don't even give you that range from 6.0 to 6.5, no ma'am. Thank
Yeah.
you, doctor.
Yeah, I mean, that's the normal, that's the guide, what the guidelines say. But then, of course, people want to catch it early, start medication early, so they might start medication earlier.
6.0.
Because you also don't want to keep getting worse. All right, so this was a brand new study. This came out this month, okay? This month. And they split people into, again, either this plant-based diet, and they did a bit of exercise as well, or to take metformin, follow what their doctors were saying. And this group over here, again, this is A1C, so we're looking at blood sugar control over 3 months. The group that just followed normal orders, they kind of didn't do too well. The group that changed their diet and exercised more, their A1C was reduced as well. And what's also very cool, so it reduced by an average of 2 points. So if you start at 6.8, end at around 6, 63% of them, more than half of these people, also cut down on their medication. So their insulin doses went down. Some of them were able to stop their medication completely. So starting on metformin and everything, were off it by the end of the study. And the other thing, this plant-based diet is not just for diabetes. When we're talking about blood pressure, heart disease, it's good for all of these. High cholesterol, it's good for all of these. So it also improved the rest of their health. Now, you were saying something about carbohydrate quality, right? Yeah, so what's wrong with this picture? Well, lots of extra sugar, right? They take sugar and add it to all of these things to make it super sweet, so we want to eat it. High in fat, okay? They take away the fiber. We're going to talk about fiber in a second. And they're also higher in calories, so they promote weight gain. Okay, when you're talking about fruits and vegetables, it also has normal natural sugar, which is important. But these are lower in calories, low in fat, lots of fiber, and they also have very important nutrients found in plants that help to fight inflammation in the body. Okay. So, this is a potato, right? We were talking about potatoes earlier. Yeah, okay, it makes a difference if it's a normal potato or French fries. Okay, so unprocessed, this is how you pick something out of the ground or off a tree, fruit, vegetables that haven't had anything done. Then you process a little bit. You can bake it, boil it, however else you want to cook it. And then you can take it a step further and deep fry it in oil and add a bunch of extra ingredients. And then you get ultra processed, which these don't even look like potatoes. If you hadn't seen these, you wouldn't even know they came from a potato, okay? So when we're talking about carbohydrates, we want to stay on this side of the spectrum, okay? So raw fruit and vegetables, baked, boiled, this stuff shouldn't even be called food sometimes, okay? So we want to skip these, keep it to the healthy carbs, all right? Those have much more fiber. Okay, what do you think? Does this have more carbohydrates and sugar or more fat? What do you think? Fat? All right, well, I can go home. I don't think you guys need to learn anymore. Most people think of these as carbohydrates, right? Because it's a potato. Potato has lots of carbs and sugar. All right, no carbs or fat in the salt, but then they're cooked in oil. And more than half of the calories that come from potato chips is from fat. So this is actually a fatty food. Yeah, because it's cooked in all of this oil. So when people think, I must need carbohydrates, this isn't even really a carbohydrate food. This is a very fatty food. Okay. So again, keep it to the less processed forms of this food. Okay. All right. Now, again, I want to be clear. If you have type 2 diabetes, you don't need to avoid carbohydrates. The problem isn't the sugar. The problem is our body can't handle the sugar because we eat so much of these fatty foods. Okay. And a lot of the benefits from fruits, vegetables, beans, grains comes from the fiber. Now, fiber is the part of fruits and vegetables that we can't absorb. We can't digest it. Okay. So it just passes through and comes out the other end. Okay. And it's good because it helps to bulk everything up inside, helps to keep you regular when you're going to the bathroom, and it has a lot of other benefits. So it keeps you full for longer, okay? Fiber adds a lot of volume to foods while keeping the calories low. So when you're eating a lot of high fiber foods, stretches your stomach, that sends a signal to your brain, hey, I'm full, don't eat anymore, and then we don't overeat. Also lowers the risk of lots of diseases. We've seen type 2 diabetes, heart disease. People that eat the most fiber have the lowest risk of these diseases. Okay, helps to keep us regular so that we aren't constipated, and also helps to trap cholesterol. So it kind of acts like a sponge in the intestines, and it slows down the absorption of cholesterol. So if you have high cholesterol, you want to eat lots of plants so that you can get this fiber and slow down how much cholesterol you absorb. Helps to keep our blood sugar normal as well. When you eat high fiber foods, that fiber makes sugar get absorbed a lot slower. So you eat a donut, your sugar goes like that, and it comes back down. If you eat an apple or something with lots of fiber, increases much slower. Okay, you don't get that huge rise and then that huge crash at the end as well. And it also helps to promote weight loss because you tend to eat fewer calories because it's so much more volume. Okay, so imagine this car runs on gas. Are you going to put diesel in this car? Why not? It's going to mess the engine up, right? So if we are supposed to be eating lots of plants and we're eating a whole bunch of donuts and fatty meat and all of these other foods, it's also going to mess up our engine. It's going to mess up our cells, okay? So we have to talk about putting the right fuel into our body. Otherwise, it's going to damage us on the inside. Okay, so you may be thinking, sheesh, if I start eating a lot of carbs now, surely my blood sugar is going to go sky high. We see that people can actually reduce their blood sugars in even a couple of days, even within a week. This isn't a 6 months, stick to the 6 months before you see any results. We've seen people I'm involved in some clinical trials on diabetes where we work with patients, we put them on this diet, and a lot of their blood sugars improve within the first week just by changing your diet. Okay, this isn't a long thing. And in just 1 week, the fasting blood sugar, so that's the blood sugar you do first thing in the morning before you've eaten anything, dropped by 29%. Okay, that's actually quite a big number if we're talking about research, so it drops by quite a lot. And they were nearly able to half the amount of insulin that they were using. So if they started with 20 units a day, by the end of this, they were on, my math's not so good, maybe like 12 units. Okay, so the insulin dose came down as well. Why? Because we were getting all that fat out of the cells. Our cells respond better to that insulin that comes to unlock them, and our blood sugars improve. Okay, so the insulin works better. All right, but what about weight gain? Have you guys heard that carbs make you gain weight? Yeah. Okay, well, carbs have fewer calories than fat. So if we're looking at the same amount of carbohydrates and fat, 1 gram, 1 gram of carbohydrates only has 4 calories. 1 gram of fat has more than double that, 9. Okay, so that essentially leads to this picture. 500 calories of oil takes up a very small amount of space in your stomach. Very high calorie, not much nutrition. You don't want to be taking shots of olive oil or sunflower oil or any of that, okay? We don't recommend that. Cheese takes up a little more space, meat a little more, grains and beans more, and fruits and veggies can fill up the whole stomach for 500 calories, okay? So you're eating more carbohydrates, you're eating even more food. Some people are like, I can't eat this much food, there's too much food. But you're actually getting even fewer calories, and this helps you to feel full for longer. Okay, so actually does the opposite, it helps you to lose weight. Okay, very easy to eat a lot of oil and not be full. Very difficult to eat a lot of fruits and vegetables. Okay, everyone with me so far? Does anyone have any questions so far?
I'm just trying to absorb it all.
There's a lot. I think Hillary's recording.
Yes.
Okay. Yeah.
Cheese fill you up.
Cheese and yogurt?
Cheese
Cheese, yeah.
fill you up.
She said cheese fill you up.
No, not as much as fruits and vegetables. I think I'm going to need some extra time to convince you. I'm not too convinced right now. So, same number of calories. Cheese is only going to be a little bit. Doesn't fill up your stomach. Same number of calories. You're getting a whole lot of fruits and vegetables. It fills your stomach up and makes you feel full. So you're getting the same energy, but you're getting much more food when you focus on plants. Beans, rice, potatoes, sweet potatoes, fruits, vegetables. You don't look convinced yet. Very skeptical. Not yet, okay. Plants also help us to burn more calories. Okay, so this was a very cool study. We measured people's metabolism after they ate meals. When people ate plant-based meals, high in fiber, they burned around 14% more calories after a meal. You might be thinking, okay, 14% is not that much, right? If we're thinking about, say, a 500 calorie, like we saw, 500 calories of food, might be an extra 70 calories that you burn. Not so much after one meal. Add that up, breakfast, lunch, dinner, 365 days of the year. you end up burning a lot more calories, okay? Because these plants are more difficult to digest, so your intestines and your body has to work extra hard to digest them, okay? So you actually burn more energy when you're eating these plant-based foods. Okay, what about the complications of diabetes? What are some of the complications? Kidneys,
As.
vision, amputations, everything.
Toes.
Right? Toes, nerve damage, yeah. Lots of complications. Do you think it's too late after you have one of these complications to change your diet? No?
No.
Oh, I love you guys. All right. So this is kind of what we do. When we go to McDonald's, we get a heart attack with extra cheese, heart attack with extra bacon, double bypass, no pickles. Hey, where's my diabetes and large stroke? All right. This is what we're doing when we're ordering this fast food. We don't want that. So, back in 1985, I believe it was, there was a doctor called Dr. Caldwell Esselstyn. And he was at the Mayo Clinic, and he took his patients with heart disease, and he was like, I wonder if we can reverse this. So he took these people, put them on a plant-based diet, and he did these angiograms. This is a scan of your heart, okay? So what we do is we inject a dye, it travels in your arteries, and it fills up all these little blood vessels that are giving your heart oxygen and energy, okay? Because remember, your heart's a muscle.
Right.
It's pumping, so it needs oxygen, it needs glucose. And these are the little arteries that take all this blood to your heart. Okay, so we fill them up with dye so that we can see if they're narrow or not. If you have heart disease, your artery is narrow, okay, because there's all that plaque in the walls. So blood's not really getting to the heart muscle, okay? So this is the beginning. All right, you can see beautiful. Oh, looks a little bit narrow there, okay? So this is the spot where someone would have a heart attack because it's so narrow, okay? After they were on a plant-based diet, this one was for 60 months, so 5 years, so a little bit longer than with the blood sugar. Look at the after. Okay,
Wow.
so more narrow,
It is red.
it's wider.
Right.
So the artery opened up. That heart muscle is getting more blood, lower chance of a heart attack. A lot of these people had angina. Do you know what angina is? Chest pain. Chest pain when you walk or you run or you climb stairs, people get chest pain because
Okay.
that heart muscle is not getting enough oxygen, so it's starved and it gives you pain. Feels like someone's kind of sitting on your chest, similar feeling. And some of them were able to reverse all of their pain because their blood vessels opened up. This is another one. Look at this. Yeah, of course.
That's fascinating.
Right?
I had no idea. Is the plaque actually disappearing?
It seems that way. It does seem that way. I mean, they didn't actually look inside. They didn't do a, but yeah, you can see that it opens up. So either that plaque is regressing or there's more dilatation from all the nitrates in, plant-based foods. So that could have also contributed to it. And there's another one called the Lifestyle Heart Trial you should look up. Dean Ornish, he found very similar results. And the actual diameter increased. This is another one.
We have another question.
Oh yeah, sure.
How long did you say it took for it to?
So this one was 5 years.
It was 5 years.
Yeah. So blood sugars can improve within a week very quickly. Something like heart disease, this has been developing for 10,
Years.
20, 30, 40 years, okay? So it takes a little bit longer to see these results, okay? This is another one. Look at this. Ugh! Looks like something's almost gone and taken bites out of here, right? Very, very narrow. This artery is, this is the main one that runs down the middle of your heart. It's called the Widowmaker, which is not a nice name because if you have a heart attack there, your chance of survival is very low. Okay, so this is very, very important. Look at that. 32 months. What's 32 months?
32.
Nearly 3 years? Nearly 3 years. Look at that. So much wider.
Yeah.
So even, it's never too late, okay? No matter how long you've had certain conditions or how far down you are, how many medications you're on, it's never too late to change your lifestyle, okay? Eyes, someone mentioned eyesight. Why do we lose our eyesight? With diabetes, what can happen is you can get these small little bleeds in the back of your eye. So this picture is someone looking right through into the back of the eye and taking a picture, okay? So So these are little bleeds where your little blood vessels have popped and there's blood leaking into the back of the eye. And that means that we can't see very clearly. And this was a really crazy man, okay? In the 1970s, he took his patients with diabetes, put them on a fruit and rice diet. That's everything you've been told not to eat, okay? This is like the devil's food. And he took another picture, and look at that. These little spots have gone away. These bleeds have gone away. Same eye. And with this, their eyesight improved. And that exam room podcast that you know about, that we'll send around, there's a wonderful lady called Mary. And she, why are you laughing at her name? That's not very nice.
That's her name.
Oh, is it your name? Well, we'll have to get you on the podcast as well. I was like, that's not very nice. So there was a lady called Mary. She had type 2 diabetes for many years. She joined one of our programs and she switched to a plant-based diet. And when she joined the program, she was declared legally blind. She couldn't drive, could barely see. She just saw lights and shapes and shadows, but she couldn't see someone like this. And after our program of being on a low-fat plant-based diet, she regained her vision after being declared legally blind. Okay, pretty amazing stuff. And I'll send Hillary the podcast so you can all listen. She tells her story. It's amazing. She regained her vision. So we're not only talking about just blood sugar levels, we're talking about quality of life. Okay, seeing, that kind of thing. Now, someone also mentioned foot pain.
Hello.
Yes, Mary.
I lost my eyesight one time.
I'm sorry?
I lost my eyesight one time.
You lost your eyesight as well?
Yeah.
From what? Diabetes.
Yeah,
Wow.
because it came back the same day.
Oh, that must have been very scary.
It was, I was driving.
Oh gosh. Have I convinced you to eat some plants so that it doesn't happen? Some tofu and beans, or not yet? Alright. Someone mentioned nerve pain as well. So all these high sugar levels, it damages your nerves, okay? Hands and feet. Good news. Okay, we're getting to the good news. Again, this is kind of a depressing topic to talk about, but I hope I'm giving you some hope and some good news. So it damages the nerves in the hands and feet when you have high blood sugar levels over a long time. And that means you can get pins and needles, burning pain, numbness. And again, this was a study that wasn't done by us, but they took people with this nerve pain, put them on a plant-based diet, and in just a month, 81% of them lost all of their pain. Okay.
That's good.
Yeah. So even if you have these complications, it's not too late. All right. So can anyone reverse their diabetes?
Yes.
Yes.
Yes. But it depends on a few things. Okay.
Mhm.
The first one is, how long have you had this? If you have only had diabetes for a year, 2 years, 5 years, much more likely to be able to reverse it completely. If you've had it for 20 years, may take a little bit more time. Okay. But we have seen people who've had diabetes for 30, 40 years and they come off all their medications and their blood sugar levels are normal. It's not impossible, it just happens a bit faster for people who have had it for shorter. Okay, weight also plays a very important role. So if you are overweight, the more weight you lose, the better your blood sugars will become. How many medications you're on. So if you're only on metformin, happens much faster than if you're on metformin plus insulin plus other medications. And the intensity. So how big of a change you make, okay? If your doctor gives you an antibiotic and he says take this 3 times a day, how many times a day do you take it?
3 times a day.
3 times a day?
Yeah.
You're not gonna say, oh, maybe I don't really feel like it today, so I'm gonna skip today, maybe do it again tomorrow. You don't really take antibiotics like that, right? So when we're talking about lifestyle, it's also something you have to do every day, every meal. It's not something where you can do it for 1 week, but then, it's my birthday and Thanksgiving and there's a work party, so I'm gonna skip this a little bit. No, Mary, you're out. So people who stick to this, and we see this in our clinical trials, people that jump all in, they're like, heck yes, I'm having oats for breakfast with fruit, I'm having a bean burrito for lunch, I'm having pasta and salad and bean sauce and everything for dinner. They do super, super well. The people who are like, going to a restaurant, so I guess I'll have the cheeseburger and fries, they don't do as well. Okay. All right. So, how much time do we have left? I feel like I've been talking a long time.
You're good.
We're going to quickly talk about exercise and sleep because those are also very important, and then we're done, okay? So, if you imagine you're going to a concert or something in a big stadium. You said you like gospel music? All right. Imagine you're going to see your favorite gospel artist in a big stadium. Thousands of people are trying to get in. There's only one gate open in the front. Exactly.
Okay.
Right? Not going to get in too fast, are
Right.
you? Okay. So imagine that gate is like these little channels that I spoke about earlier. What's the best way to get more people into the stadium faster? You've only got
Create
one
another
gate.
interest, I guess.
Exactly. Yeah, exactly. So that's what exercise does. When we exercise, we put more of these little gates into our cells so that more sugar can go in.
Okay.
So when you exercise, it helps to control your blood sugar levels. Okay, very cool. What kind of exercise is best? Well, a little bit of both. So cardio is things that gets your heart rate going, walking, running, on a bicycle, anything like that. Resistance training or strength training, anything that gets your muscles working, whether it's squats or push-ups or anything. And you don't have to be crazy, you don't have to become an Olympian,
That guy on
okay?
the bottom. That's out of control.
This guy? That guy's running, I think that guy's Mary running away from my tofu. All right, so a little bit of both, okay? Around 30 minutes a day is all you need. You don't need to do lots. If you don't have a gym or something, you can, I don't know if they can see me, you just do push-ups against the wall, just this. That's all, okay? That's now making your muscles work here, okay? If you can't squat, just sit down on a chair, get back up, okay? Any of those, it's building your muscle. It's gonna help more of those little gates get into your cells and help to improve your blood sugar control, okay? A little bit of both. And if you don't have a lot of time, I like to call these exercise snacks, okay? So research has found that if you walk for 30 minutes in a day, you do good, you improve your blood sugar control. But if you take those 30 minutes and you split them up into 10 minutes after breakfast, lunch, and supper, blood sugar control improves even more. So don't think I have to do an hour in the morning or an hour at night and then you're so tired by the end of the day, you end up doing nothing. Just 10 minutes, walk around the block a couple of times after one of your big meals. Gonna be beautiful for your blood sugar control.
There was another study that looked at weight loss doing the same thing.
As well.
And the group that did 3 10-minute walks lost significant, I mean, it was over a 3-month period, so none of them lost a ton of weight. But the 30-minute walkers lost something like 2 pounds, and the 10-minute walkers lost like 7 pounds.
Yeah,
Yeah.
yeah. Because what happens, you
Just
do,
for, and that was the only thing they changed
Yeah.
in their diet was or in their lifestyle was the walking.
you do the walk, and then what do? You sit down for the rest of the day and you don't move?
Yeah.
You walk, yeah. We should be doing this on a walking, okay, next time we do this, we're walking around the block all the time, okay? If you break it up after meals, you're more active throughout the day, okay? That tends to do better than just getting it all done and crammed into one long thing. Yes?
Something when I was working out, how come like when you work out, you come back, you wanna eat everything? Like,
Yeah, you feel super hungry. Yeah, that's very true. So having a small snack before can sometimes help with that. People have found if you have maybe a banana or something before, they don't get as hungry afterwards. Sometimes we don't eat, for a long period of time, exercise, we get even more hungry. Remember, you're using the sugar in your body when you're exercising, so you do need to replenish it, okay? You just need to make sure you don't eat the wrong kind of foods then. Don't be like, oh, I just did a 30-minute walk. I deserve to treat myself with some Krispy Kreme donuts or something, okay?
Right.
Not that I'm hating on Krispy Kreme, but then you go if you have a nice meal full of that fiber, lots of beans, that's going to help you feel full for longer over time.
It is hard to like replace like the bad snacks with like good stuff.
It's hard.
That's like credible. Like I'm
Yeah.
not gonna sit there and eat a rice cake. And I don't wanna I need something that's comparable.
Yeah. So do you know your taste buds at the back of your tongue that you taste? Do you know how long it takes for them to, what's the right word?
Get accustomed.
Yeah, or they replace themselves every
Oh.
3 weeks.
Oh.
Okay. So you may love salty, sugary foods now.
Mhm.
You take a bite, an apple doesn't taste that sweet. You give it 3 weeks, your taste buds all get replaced, and they accommodate the new tastes.
Oh.
So if you stick with it for 3 weeks, you'll find that an apple tastes super sweet. I
Okay.
can't even eat some sweets now. I'm like, oh, that is way too sweet, when before I was eating them every day. Because your taste buds change.
Okay.
Okay.
They crave the kinds of foods that you feed them.
Oh.
So you eat lots of fruit and sweet potatoes and everything, you're gonna crave those foods because that's what your taste buds are used to.
That's promising.
Yeah, it's really cool.
Yeah.
Try it and stick with it for 3 weeks and let me know how it goes.
Okay.
Okay. Okay, a quick one about sleep. How many hours of sleep do you all get? What do you think?
I don't get
About
enough.
6? You don't get enough?
Mm-mm.
I probably don't get enough either.
No.
Okay, so if we don't get enough sleep for one night, maybe there was noise outside or you went to bed too late, you only get around 5 hours of sleep, we end up eating more calories the next day. So we found that if you take people, you restrict their sleep, you wake them up too early, they end up eating even more the next day. Okay, and that is because, well, we'll get to that one. Sleep impacts your hunger hormones. So if you don't get enough sleep, it pushes up the hormone called ghrelin, and that makes you feel more hungry. Okay, you get enough sleep, those levels stay normal, and you don't get as hungry. It also increases cravings for unhealthy foods. Right, if you slept 5 hours a night, do you feel like a salad or do you feel like something nice and sweet? Probably something that's not so good. Hmm?
Both.
Both? Mary's eating salad, y'all. All right, so we crave unhealthy foods when we don't get enough sleep, and it increases our stress hormone called cortisol, and cortisol also pushes up blood sugars, okay? And what else happens? We move less. You're tired, do you think you're gonna exercise that day? Probably not. I'm gonna want a nap, I'm gonna wanna sit on the couch. So we move less, we eat more unhealthy foods. And the ideal amount of sleep that you should be aiming for is around 6.5 or 7 to 8 hours every night. Okay. Research has shown that if you get less than 6 hours, A1C is higher, that 3-month blood sugar control. If you get more than 8, you're sleeping too much, 9 hours a night, also results in a higher A1C. So we want to keep it to around 7 to 8 hours. That's what seems to be ideal. Sleep quality is also important. Okay. Not only the amount of sleep, but you also need to be getting the right kind of sleep. So how can you improve your sleep quality? Try and set up a routine. Go to sleep the same time every night. Wake up the same time in the morning. Avoid all screens before bed. I'm hearing some laughs. I know we're all guilty of this. You lie in bed at night, you're like, I can't sleep. Let me watch some videos or chat to someone or go on Facebook or Instagram.
Game.
Play some games. Candy Crush, is that still a thing? Yeah, you do that. All of the blue light from your phones actually keeps you up.
Yeah.
Okay, so it's not actually helping you. So an hour before bed, I know I'm going to bed at 10, 9 o'clock, you switch off TVs. No lying in bed or on the couch watching TV. You switch off your phones. You don't take your laptop and sit and work in bed. I know a lot of us do that. Avoid caffeine and alcohol 4 to 6 hours before bed.
Really?
Yeah, caffeine keeps you awake.
Mm-hmm.
Alcohol doesn't keep you awake, but it affects the quality of your sleep. So you don't get as much deep sleep, which is what we need to feel rested.
Oh.
Okay.
With
Yeah.
with either one?
Caffeine keeps you awake for longer, so you
Yeah.
get less sleep. Alcohol, sometimes it makes you feel a bit sleepy, but it means that you don't get that deep, restful sleep. So you're asleep, but you don't wake up feeling rested.
Depend. Coffee don't keep me awake. In the morning, keep me awake. At night, don't keep me.
What is
me
it,
awake.
coffee said?
Yeah, coffee.
No coffee at
coffee.
night.
You don't keep me what?
Maybe it doesn't keep you awake, but it could be also impacting the quality of sleep that you
Oh, the
get.
quality, okay.
Okay.
I sleep by
If it
5.
works for you, don't change it. If you're not convinced, don't change it.
I'll give it a try.
My biggest critic over here, Mary. All right, exercise is better in the mornings. If you exercise right before you go to bed, it can keep you awake as well. So try and exercise in the mornings, it's better. Make the room as dark as possible and try keep it a little bit cool. Research has shown that helps us to sleep a little bit better. Okay, so to sum all of this up, if you want to improve blood sugar control, look at reversing diabetes, coming off medications, what should you do? Avoid meat, eggs, and dairy. Focus on the power plate, Mary. Lots of beans and rice and sweet potatoes and fruits and vegetables. Try and cook without oils, veggie broth.
If you are cooking with oil, because I've been using a lot of coconut oil lately. No?
Mm-mm. So coconut oil is higher in saturated fat.
Oh.
You know saturated fat?
Olive oil too? That's
Olive-
what I use.
Olive oil is better. It doesn't have
Olive
as
oil.
much saturated fat.
Oh, okay.
So if we're talking about oils,
Canola.
canola's okay, grapeseed is okay. Try and use them in little amounts,
Okay.
not too much, because remember they have lots of calories for not a lot of food. Okay.
Okay.
So they add a lot of calories to your meal without making you feel full or giving you much nutrition. But if you are going to cook with oil, choose something like avocado, olive, even a little bit of canola or sunflower oil is better than coconut oil.
Okay.
Coconut oil, palm oil, very high in saturated fat. It can raise your cholesterol. Okay. Put coconut oil on your skin,
Yeah.
on your hair,
That's what I thought
anywhere
about.
you want. Do not put it in your coffee or your food
Oh.
or any of that. Okay.
And fish, salmon, fresh salmon, that's no fish, no salmon.
Some of those fishes can be high in fat as well. So when we're talking about this plant-based diet, we recommend leaving them out. Okay. If you don't want to go all the way, keep it to a minimum. Okay.
So I heard sunflower was, I'm not like trying to say.
No, go. No, ask the
I
questions.
heard
That's why I'm here.
Sunflower oil was not good.
Watch the podcast.
Okay.
Yeah, I'll say too.
There's a lot of misinformation about oils.
Yeah.
Again, keep them to a minimum. I'm not saying pour it all over the pan or a salad or anything, but a little bit actually isn't
What
bad.
about your regular vegetable oil?
That's just a blend of like sunflower. That's
It's a
a
blend.
yeah. I think just if you get something that says vegetable oil, it's usually a bit of a blend. Okay. So again, just keep them low.
Okay.
Walk for 10 minutes after at least one meal, preferably after lunch and dinner if you can. Include a little bit of strength training, even if it's, again, just sitting and getting up, sitting and getting up. Anything that's building those muscles. And the walking, that can be the cardio. Sleep 7 to 8 hours a night. And make sure you do those, don't sit on your phone playing games before you go to sleep.
Boo.
Okay, how do I start? I feel like this is Mary. She doesn't want to just eat salad. She's not convinced. I'm picking on you a lot, Mary. I'm sorry.
I don't mind.
You don't mind? Okay, good. You can eat pasta, sushi, these beautiful smoothies, baked potato skins, curries, dals, lots of awesome foods. We have lots of recipes on our website. And if you don't know what to do, take 1 week to brainstorm. Think about all the foods that you like. How can I make them low fat and how can I make them plant-based? If you eat spaghetti with mince and meatballs, try spaghetti with lentils in place of the meat. If you, I don't know, what else do people eat for breakfast?
What lentil?
Lentils,
Yeah.
a little bean.
You mean
Oh.
It's a little type of bean. Try them.
They're really good, Mary.
They are.
Trust me.
So make a list of all these foods you can try. Week number 2, try these recipes. Try make 1 meal a day plant-based. And week 3, you go all in. Commit to it for 4 weeks. If you hate this, you can always stop after 4 weeks. Okay? It's not a lifelong commitment, but give it a try. And we have some food at the back here so you can taste how delicious this can be. An example, some oat with fruits and raisins for breakfast. Maybe a wrap for lunch or a bean burrito, some sweet potatoes. Dinner can be a whole wheat pasta with some chickpeas and tomato sauce or a bean chili with rice and then snack on some fruit. Okay, they look quite nice. And then I just want to mention 2 more things and we'll be done in about a minute. This is our app. You've got a little card on the tables. So this is our 21-day kickstart. Okay, so if you sign up for this, you'll get 21 days of recipes, resources. They're little videos for each day that you can watch to learn a little bit about different conditions each day.
Okay.
One day might be about diabetes, one day might be about cholesterol. This is available in English and Spanish. And we have our National Diabetes Program. So this is a webinar we have every week, Tuesdays, 12 to 1.
Oh, okay.
I run it with
Okay.
another dietitian, Anna Herbie, and we meet every week. And we do a little bit of a check-in, so we ask people, what are your challenges, how can we brainstorm? We do a little presentation, so you're getting some education and information as well. And then we always have a success story, someone who started off eating Philly cheesesteaks and you know, all of these foods, and went plant-based, and they can give you advice. How did they start? What were their challenges? How did they overcome them? We have 3 dietitians that join us each week that are there to answer questions. I think we got about 50 questions last week. You know, what about the soy? Isn't it bad for breast cancer? How do I cook without oil? Anything. We have dietitians that can answer all those questions. It's completely free. You just sign up and you join and you can get all of this. And I can send this link to Hillary as well to share with you all.
Okay.
All right. So to end this off with a quote, people are fed by the food industry, which pays no attention to health, and are treated by the health industry, which pays no attention to food. So if we think back to the start, most diabetes is due to diet, okay? So medications is not the best answer if you're not changing your diet as well. Okay, so we have to go back to the start. All right, and that is all I have for you. We have some food. We have a lentil soup, Mary, so you can taste lentils. And we have a falafel wrap, which is made from chickpeas. So there's food over there. You guys can grab that. And then I think we can go into the food pantry and take any questions if you guys have any.